Hello, good morning, everyone. Thank you for joining us. I hope you're all safe and well, and you can hear and see me on your screens. For those of you who don't know me, my name is David Babington. I'm Chief Executive of Action Mental Health, and I'm hosting today's online event. I'd just like to thank you all for putting some time aside to join us for this really important Transgenerational Trauma Awareness Day event. I know it's a really busy time of year in the run up to Christmas, but you're very welcome for what I hope will be an interesting and insightful event. What's going to happen is I'm just going to make a few introductory remarks, and then we can hear from two expert speakers. I've looked down the attendee list this morning, and I'm delighted to play host to an event that has so many great organisations and individuals in attendance from across the UK, Ireland, Europe, and even some from the States. If you want to spread the word about the event and the day, please use TTAD, hashtag TTAD23 on Twitter during the event. And the other tagline for today is hashtag expand the conversation. And that's what effectively we want to achieve this year with this very important awareness day. And I must make you all aware at the outset that we are recording all of today's proceedings, and a copy will be available after the event. So this is the third year of Transgenerational Trauma Awareness Day, which was created as part of the Our Generation project. And the Our Generation project was a EU Peace 4 funded project that ran from January 2020 to September 23 to provide a unique opportunity for communities north and south of the border to work together to halt the intergenerational trauma, impact of trauma, and to build emotional resilience and peace for future generations. And match funding came from the Executive Office here locally and the Government of Ireland for the programme. And I have to say it far exceeded expectations. It engaged even more children, young people, and the key contacts than originally anticipated in education, youth, and community settings across the 5 urban village areas within Northern Ireland and the border counties of Donegal, Sligo, Leitrim, Cavan, and Monaghan in Ireland. So there's a total of 51,773 children and young people and key contacts took part in the emotional resilience and peace building programs. And this was despite, if you remember, the early setbacks of COVID and lockdowns. And we only achieved what we did with the Our Generation partners, who were Action Mental Health, Cooperation Ireland, Donegal Youth Service, Playboard NI, Youth Action NI, and Youth Work Ireland, and of course, Ulster University, who we'll be hearing from shortly. A huge thank you to them and our funders who made it all possible. So in terms of Transgenerational Trauma Awareness Day, it was during this programme the team noticed there was an awareness day in the calendar for all sorts of worthy causes and initiatives, except transgenerational trauma. So the day has been created not only to provide a lasting legacy to the project, but to continue raising awareness of this really important issue and to expand the conversation around transgenerational trauma. As I said already, the fact that over 250 people registered for this online event shows the level of interest in this subject area. And I think it comes at a really apt time where we only have to turn on the TV to see the turmoil and conflict around the world and think what trauma may be passed on to future generations by those conflicts, and more importantly, what steps we can take to address it. So in terms of today, we'll be focusing on the best practice guidelines publication that was produced by the Ulster University team during the Our Generation project. And this will look at trauma-informed practice and peace building and how we might address division and discuss our differences in a way that is trauma-informed to help the promotion of well-being and healing. There is a Q&A function at the bottom of your screen, so please add any questions in there, and the panel will do their best to answer them at the end. So after both the speakers, we'll collect all those questions and look at them together. So I'll now introduce you to the first of our two academic experts on this subject who will speak with slides. Our first speaker needs little introduction to those living locally. She is Siobhan O'Neill, Professor of Mental Health Sciences at Ulster University and Mental Health Champion for Northern Ireland. And as a reminder, her research focuses on trauma, mental illness and suicidal behaviour and the transgenerational transmission of trauma. And I would say that in the unique position as Mental Health Champion for Northern Ireland, she advises and assists in the promotion of mental health and wellbeing through all policies and services throughout the province. And her role really is as a public advocate for mental health and to be a voice for those otherwise voiceless. Siobhan, over to you.
Thank you so much. And hi, everybody. Welcome to our Transgenerational Trauma Awareness Day webinar. I'm going to share my slides here. Let's see if this works. Here we go. And we'll pop them on there. Right, so you should see me, and most importantly, you should see my slides. So David, as David explained, Transgenerational Trauma Awareness Day arose from a project called Our Generation that we partnered with David's organisation, Action Mental Health. And it was Peace4 funded. So I don't need to go through all of that because David gave you a wee bit of detail there. But I think it's helpful just to let you know, to start off with, where these recommendations and these best practice guidelines came from, why they were developed. So in our generation, what we were doing was we were providing age-appropriate prevention, early intervention and recovery activities around mental health and resilience for young people who were in deprived areas or border areas of Northern Ireland. So we were using these interventions to build peace, bringing young people together and talking about mental health and resilience and emotional regulation. And the rationale for that was the idea that when we're in a fight or flight state, or when we're in a state of anxiety and fear, it's very difficult to connect, to understand other people's perspectives. So mental health and peace building go together. When we're feeling well, we can connect with people, we can understand other people's perspectives. But you know, if we live in a society that's divided, that might not always be the case. And there was a huge need for resilience programs. So our programs covered coping, problem solving, perspective taking, and really importantly, things like intergroup trust, contact between different groups, mental health outcomes there. We were interested in improving people's mental health and also improving people's empathy and attitudes towards different groups. And ultimately, we wanted to empower children and young people to act as agents of change in their communities. So as part of this project, we developed an outcomes framework, an evaluation framework that really tapped into how well we were doing on the key factors that would lead to peace building, that would develop the indicators of peace building in these young people. So we have knowledge-based indicators there, but as you can see there in this little slide, we had indicators that related directly to peace building. So contact with the other group, that was the first. And a lot of peace building interventions are about contact, and sometimes they go, you know, they don't go far beyond that. We wanted to develop intergroup trust, empathy, empathic concern. We wanted to build skills in terms of perspective taking in our young people. And we wanted to look at mental health and well-being and, you know, get improvements there. We wanted to improve coping and problem solving. Absolutely key to good mental health is to be able to emotionally regulate and cope. And then we wanted to change attitudes towards the outgroup. So as part of our peace building intervention for Peace4, we measured all of these things, and we wove these into our mental health and resilience programs. So what did we find? What were the differences? So David gave you the scale of activity. Over 50,000 young people were involved in this. Young people and their parents, their caregivers as well. But in terms of children and young people aged 11 to 25, we can see really high numbers there, really high percentages that are telling us that they know more as a result of the program, that they've learnt, that it's worthwhile for them, and that they've gained confidence and that they intend to use what they've learned. So that's really, really positive. Some other really interesting findings is that even in children aged 4 to 11, you see the top left, our interventions improved these attributes around intergroup contact. So being able to speak to people who are different from them, people around them to share their emotions, people around them to ask for help if they have a problem. Intergroup trust, they know more about what community means. They know things about their community. They do things that are special to their community. They recognize different communities, and they know facts about different communities. So again, like really big increases there as well. And in terms of empathic concern, we have a bit of an increase in terms of seeing someone being taken advantage and being able to help them. And other people's misfortunes don't disturb me to a great deal. That actually went up on ours. In terms of mental health and well-being, most of our indicators showed improvements there as well. So in many of these, that was negative changes were actually improvements in mental health and well-being. So by and large, we achieved a lot of the things that we had set out to achieve in terms of our project. Sorry, we're not on to the next one. Perspective taking, again, increases intergroup trust. The one indicator that's really exciting for me is I trust the other community when they say that they love Northern Ireland. And that went up by a massive 26% pre and post. So we're tapping into things that we feel are important for peace building, whilst also recognizing that that mental health is important and making those changes in mental health. And that's really positive. And I don't think there's many programs that measure these sorts of changes. So I think that's something going forward that we need to make sure that that future peace programs do that we're actually measuring the types of changes and the attributes and concepts that are related to peace building. However, it's Transgenerational Trauma Awareness Day, and we're always aware of the trauma that exists within our communities, and particularly in the communities that were our target audience, I suppose, for our generation project. So transgenerational trauma, well, I think it's helpful to look at what is transgenerational trauma. It's really when the trauma in one generation affects the children of the next generation and affects them growing into adults. So it's passed from one generation to the next generation. Now, in previous TTAD webinars, we've covered this in a lot of detail, so I'm not going to go into too much detail on it today, but I think it's helpful to give this as a framework so that you can understand where our best practice guidelines came from. So one of the main mechanisms by which trauma is passed from one generation to the next is through childhood adversities. And I'll explain that in a wee bit of detail in a minute. There's also the epigenetic impact of trauma. It affects the person's biology, and those biological changes are passed from one generation to the next. So the idea of the hypervigilance that comes as a result of trauma exposure is actually passed on as part of the changes to the surface of genes. And the next generation then are more likely to be hypervigilant, even if they haven't been exposed to trauma directly. It's like they're being prepared for the world that they're going to live in. There's also trauma exposure in utero, in the womb, as the child's developing. That impacts on the developing body and brain in such a way, again, as to change how that child responds to stress. In Northern Ireland, there's also the very real narratives that exist within families, things that have happened to parents and grandparents, and even going back further than that, great-grandparents, and how those stories are told. And they affect the next generation. They create the story of the family story can be a source of trauma that affects children. So there's also the community effects. When you're living in a divided community, that is a type of trauma. You have fear of the other, fear of people who are from a different community, regardless of what that community is, this idea that there is a threat out there. And that then is a trauma that's passed from one generation to the next, and it sets up those pathways in that generation as well. We also have legacies around poverty and disadvantage, and we know that the communities that were most affected by the Troubles in Northern Ireland are the most deprived communities right now, and they continue to be affected at the minute by the cost of living crisis, for example, but they haven't seen the dividend of our peace process. There's ongoing political tension, particularly at the minute, the lack of leadership in certain communities, and particularly deprived communities. And that legacy creates a sense of fear, and could be argued that that's a trauma that's affecting the children in those communities now. And then there's a legacy in terms of justice and truth. You know, and we see that families are seeking justice, and their quests for justice can create adverse environments for the next generation, and the children can be part of those quests for truth and justice, and the sense of fighting against whatever the other is, or the state in some cases as well. But in our generation, in terms of our best practice guidelines, we were asking the question, can our attempts to build peace, as a result of all of this, can our attempts to build peace be in some ways re-traumatizing? When we're bringing people together, can that be a source of trauma? Can it activate trauma triggers? And how do we reduce the likelihood of that happening? So when we're telling stories about the events of the Troubles, when we're talking about our differences, can that actually have a negative impact on the people who are involved in that? And how does all of that work? So in order to understand the whole principles of trauma-informed practice, it's helpful to look at what happens whenever we have a trauma exposure, what happens in our body and in our brain, and what that looks like, because that's the foundation for all of this as well. So at a very basic level, being trauma-informed is about thinking not about what's wrong with you, but about what has happened to you that has led to the behaviour that we're seeing, that has led to the feelings and behaviours. And of course, mental illness is really the clusters of feelings and behaviours that lead us to do things and feel things that are aversive, that get in the way of our ability to live our best lives, if you like. So being trauma-informed is about really thinking what has happened to us in our past that has led us to feel and behave in a particular way. And when you look at all of the definitions of mental illness and the different criteria and the symptoms of mental disorders, if you go into the manuals for the psychiatric associations who design this stuff and who dictate what the symptoms are, you can see that they're feelings and behaviours, collections of feelings and behaviours. So being trauma-informed is about thinking about what has happened to us to make us feel and behave in a particular way. And ultimately, it's about the effect of stress and trauma on the body and brain. So I like to use this little diagram to explain what happens to us whenever we are hit with stress or trauma. So stress is part of everyday life. Stress is something that we experience on a day-to-day basis, and our capacity to cope with stress is a really important thing that protects us from developing mental health problems. So whenever we have stress in our lives, we move from that safe and social place in the middle, where we're calm and engaged, where our bodies are relaxed, where we can focus and think and connect and be creative. We move from that state into the fight or flight state. And of course, the fight or flight state is the mobilized, aggressive state. It allows us to fight animals. It allows us to run away. It allows us to attack aggressors. It's our brain's setting that keeps us all safe, that keeps us alive. And our ancestors who had this survived, and they had babies, and this was passed on and passed on. So now we're left with these circuits. So we move into fight or flight, and hopefully then whenever the stressor or the aggressor has gone away, or we've fought the good fight, where we can go back into safe and social. But some of us are stuck in fight or flight all the time because of the chronic stress that we live through every day. And that is the state of anxiety and hypervigilance. Whenever we have a significant, terrible event that happens to us, that's the shutdown state. That's the trauma response, where we become disconnected, where we sink into a state of hopelessness, arguably, where we become frozen and numb. So that is the brain's way of protecting us from something huge that has the capacity to really change our lives or change the way we live our lives. So hearing about a sudden death, being involved in a bomb blast, all those sorts of things will plunge us into the shutdown state. Even the diagnosis of a serious illness. So any really, really bad news can get us into that trauma state. And little children who have people shouting at them and terrible things happen to them regularly can become stuck in that traumatized state where they can't get back up to safe and social. Or you can have children that are stuck in the fight or flight state where they're just constantly anxious and they're not able to get themselves back down. So our generation, we were teaching young people about this in our programs and helping them work their way around this, showing them strategies to move from fight or flight into safe and social, helping them understand how their brains work in all of these different settings. So, I mean, this is the basics of resilience, of resilience training. Resilience programs will be about this. But it's an important part of our trauma response and our understanding of the trauma response too. So when someone has a traumatic event, a trauma exposure, there are different symptoms that can arise as a result of, let me go back a wee second, as a result of that fight or flight. That anxiety response can be triggered, and also the shutdown response can be triggered, and sometimes at the same time. So the person can be mobilized so that they run away, they're vigilant, but then also, and sometimes after the event, they move into shutdown. And post-traumatic stress disorder is where these different settings happen at the same time. And it's good to talk about PTSD in the context of trauma and the fight or flight response and the shutdown response. PTSD is characterized by 3 sets of symptoms. It's flashbacks and nightmares. So this is where the brain can't put the trauma memory into its right place. So there's flashbacks and nightmares. This has been so significant that the brain and the body are saying the person needs to be reminded of this all the time so that they can avoid it again. So the memory of the event recurs to that person in the form of flashbacks and nightmares when that person's least expecting it, unexpected. So it's not like they're remembering it. The event comes back into their memory, into their consciousness, and it is as if they're there at that time. The second cluster of symptoms is the avoidance and numbing. So when the flashbacks and nightmares happen, and they're very common, they're a very natural, normal response to a trauma. But when they happen, the person sometimes tries to subvert them, tries to avoid anything that might remind them of that event. So they go into avoidance mode, and they often would flatten their emotional affect so that they don't feel anything, to try and manage the effects of flashbacks and nightmares and to stop them from happening. And then the third cluster of symptoms with post-traumatic stress disorder is hypervigilance, where the body moves into high alert all the time, and the person's stuck in that state of arousal. And that hypervigilance can manifest as the sort of constant jitteriness, not being able to sleep, not being able to eat, even because the body can't digest food properly or there's no appetite. And things can set off that sort of hypervigilant response, such as bangs, somebody shouting, anything that would remind the person of the event can set off that hypervigilant response as well, although it's like the person's switched on all the time. So PTSD and trauma is associated with these different sets of symptoms. And people sometimes live many, many years with varying levels of these symptoms before getting any help, or before the symptoms kind of ameliorate over time. They reduce themselves over time, and they can reduce over time. But these are the symptoms that we're talking about whenever we're talking about trauma. And trauma triggers are part of this as well. So even if a person just has one or two of these clusters of symptoms, they can be easily affected by triggers that set them off. And triggers are really reminders to the body and brain of the trauma that that person has witnessed or gone through. It's nearly like their neurological pathways have been set up so that the person can fight or run away really quickly. So it's the circuits of survival working, the fight or flight response working, but the trauma triggers are activating the fight or flight or the shutdown response whenever they're experienced. So one of the things that trauma-informed practice is really about is reminding people about the importance of these fight or flight and shutdown responses and the impact of trauma on the body and brain, and the fact that triggers can be wired in to that person's responses and neurological pathways as a result of things that have happened to that person. And also recognizing that avoidance is part of PTSD, avoiding talking about particular things, avoiding reminders of that trauma. So when we're thinking about peace building here, we have people, communities, we're bringing communities together where many of the individuals will have varying levels of these three clusters of symptoms. So we will have people in the room and children in the room whose parents have these symptoms that are related to specific events around the troubles, perhaps around the engagement with the other, and fear responses that are built in around particular events that have happened to them in the past with various different groups. So it's really important that when we're doing peace building work, especially whenever we're overt about the fact we're bringing together groups that have been divided, where there have been significant atrocities, conflict, differing views of how the world is, of what way our country should be governed, who've had significant experiences of trauma and fear as a result of that trauma. We're bringing them together to talk about our mental health, to talk about things that have happened in the past. You know, these individuals will have flashbacks and nightmares. Many of them will have this. They will actively be engaging in avoidance and emotional numbing. And many of them will be hypervigilant. And their kids will be hypervigilant and will have the similar trauma triggers that parents have. They will have been told stories. Their communities will have suffered as a result of the conflict in our society. So we were so cautious and conscious of this when we were bringing together two communities to discuss mental health. You know, the irony of that as well. We're talking about emotional regulation in this context. It's really, really difficult. I found this little slide online, and I think this is so helpful when we're trying to understand what trauma triggers are. Trauma triggers can be anything that reminds that person and reminds that person's body. It's not a conscious thing. It's a subconscious activation of a neurological trigger that has been wired in as a result of what's happened to that person. It could be sounds, certain music, certain musical instruments will really activate people and can induce flashbacks and nightmares if someone has PTSD, if someone has those symptoms. Seeing people who's related to the trauma or who has a particular trait physically, who wears similar glasses, you know, or who has curly hair or whatever, the green jumper. It could be anything that reminds that person reminds that person's body of what has happened to them in the past. Thoughts, memories can bring that person back to a trauma unwillingly. Smells are really, really powerful. I have smells that I can't, perfumes that I can't bear for various different reasons to do with my own history. All of you will have these triggers, and you'll be starting to think about your own trauma triggers now and what they are. And it's good to recognize what our trauma triggers are so that we can avoid them, so that we can be aware of them, so that we can know when something's happening to us that might activate us and change how we think and feel, so we're not our best selves, so we can step back and go, right, I need to, and that's self-awareness is so important. But many people in the communities that we're talking about will have these and will not be ready to deal with them, and yet we're bringing them together for peace building. Places, very powerful triggers. I can think of examples from our own research on the Troubles of people who will not go down particular streets years and years after an event because of what happened on that day in that street. Even TV footage. And it's really important because the media one is next. There's actually some evidence that seeing, now, and this is quite radical, that witnessing something online or seeing footage of it on the media, and in social media particularly, we can see it again and again and again. And the way our media reports events, we see them again and again and again, that can actually be worse than being at the event in terms of the trauma response. Because when you're at the event, it has a beginning and a middle and an end. Whereas when you're scrolling on something on social media, it is constant and it's coming into, your world and your phone or your device or whatever. So there does seem to be some evidence that is so, so harmful, and that can create a trauma. And of course, what we see online then can trigger a trauma as well. So if we're watching something in a movie and we're not expecting it, and it comes up and it's a story, that can activate us and it can leave us feeling very, very dysregulated, and it is very real. And it seems that trigger warnings probably don't work as well as we think. Just telling somebody that that's going to be there in that movie, or we're going to show something awful now on this TV program, that doesn't seem to work because we have a negativity bias. So we're going to seek out negative stuff, and even negative stuff that activates our own trauma triggers. We sometimes can seek them out because we're interested, because we need to know more, because that's what's keeping us alive, because that's our drive to know more. So people who are really, what I'm saying is people who will be really traumatized are often drawn to things, that will trigger them, because it's part of their world. And we find that with the Troubles, with people who are really traumatized can come to things, or they can go do the avoidance thing as well. But we should be not trying to force either, to be honest. So media, feelings, just even feeling a painful feeling in our body can bring us back to that trauma. And then situations that remind us of the event can bring us back into that state of hypervigilance. And let's remind ourselves of what that is. Flashbacks, nightmares, as if we're going through it, our bodies are reacting, we're back into the fight or flight mode, stressed, angry, running. So, we're creating something that's going to lead to more conflict if we don't manage it. Or we could be frozen, numb, disconnected. So we're making the trauma worse. If these triggers happen, it makes the effects of the trauma worse. It perpetuates that cycle of trauma. It perpetuates that trauma response and consolidates the illness of PTSD. If that person has PTSD, it can make it worse, which is one reason why asking somebody to go over an event, even to talk about it in the media in an interview, to talk about it again and again and again, you're putting them through it again and again and again. And that is not helpful. Critical incident debriefing is not helpful. Intensive counselling after a trauma, where the person talks about what has happened to them and what they saw and who was there and what that was like, that can make it worse. And triggers can make the impact of a trauma worse for that person. So it's counterintuitive. We've all been told we need to talk about our mental health and talk about all the bad things that have happened to us. But in terms of trauma, if we have PTSD and flashbacks and nightmares, and we're talking about it in a way that's not part of a therapeutic counselling program for PTSD, if we're just talking about the thing, the event, not our feelings. It's good to talk about feelings. Talking about feelings helps. Talking about all the things that have happened to us that are really bad and how bad they were can make our trauma response worse. So that is what trauma-informed practice is about. It's about recognizing that violent and aggressive behavior that we see across society is a trauma response. It's a response to being in fight or flight mode. It's a response to being in shutdown. Withdrawal and disengagement can be that shutdown response to trauma. And when we're trying to build peace and help people see others' perspectives, we've got to be aware of this stuff. We've got to really recognize what it is we're doing and the harm that can come from activating people's triggers, and doing the stuff in a way that's not safe, and not doing the groundwork first. So our best practice guidelines, we felt, are a really important part of our generation. We were bringing together young people. Some of them had direct exposure to conflict. Many of them would have lived in families where there was conflict, where there was fear of the other community directly. And yet we were bringing them into a room and we were counting the numbers from this group and that group. And that was a good thing. And we were talking about our mental health, and so we really needed to be trauma informed about this. So what are the trauma informed? What's the trauma informed approach? I'm going to stop talking now in a wee minute. You'll be pleased to know, and you'll hear about the guidelines. SAMHSA, the substance abuse group in the US, developed this approach, and it's been used worldwide now. And it's really a game changer in terms of how we think about what we do. It's really about talk about the 3 R's, the 4 R's. And there's a 5th R that I'll talk about at the end as well. The 4 R's, realizing the impact of trauma and the paths for recovery. So the impact, and it's not just trauma related to conflict, war, division. It's trauma relating to everything. It's about childhood adversities that create trauma. It's also about knowing the difference between normal stress and trauma. It's not that we are all traumatized, and it can be misrepresented as that. And it's not that we all need to be victims of our trauma. Again, that's not what it's about, but it's realizing that a lot of people have had significant trauma in their lives, and it's affecting how they respond to things in their everyday environment. So it's recognizing that, and the paths to recovery. And the 5th R is the path to recovery. It's relationships, relational connections. It's feeling safe. It's really working to create safety. And in the Scottish National Trauma Training Programme, they have added relational connections, relationships as the path to recovery. It's about treatments, absolutely, and trauma-focused treatments, not just talking a lot about the things that have happened to us that are making us feel bad. It's about really working with those memories in a way that's helpful, and connecting and relating. And it's about emotional regulation. Those are the paths to recovery. Recognizing the signs and symptoms of trauma. The signs and symptoms of trauma can be aggression, violence, disconnection, disengagement. And it's recognizing that can happen not only in the groups and the people that we're dealing with. We come into communities. It's not just about us and them. It's about everybody. It's about staff. It's about families. It's about everybody engaged within that system. And it's particularly about those power imbalances where I have control. I can make decisions that impact on you, because that can activate trauma responses, and it can be a source of trauma if it's managed inappropriately. And it's about responding in a way that integrates all of this into policies, procedures, and practices. And it is absolutely about resisting re-traumatization and thinking really about, well, what are we doing that could potentially traumatize people? Are we using visual symbols that people will find really triggering, that will trigger their trauma? Are we using phrases that will be offensive to people, that will activate their fight or flight or their shutdown responses? And they don't have any control over this because of what has happened to them. It's a natural, normal process for their bodies. So how are we resisting re-traumatization? And what are we doing when it happens? Because it will happen, and definitely does happen in peace-building interventions. Because once you create a situation where people are safe enough to tell you about it, they will tell you about the impact of this stuff on them. And I have heard the stories as well. So how do we resist re-traumatization and do our work in a way that is really, really safe? The principles of trauma-informed practice, just to end with, this was our starting point for our best practice guidelines. And these have been developed again, and they're used worldwide now. Creating psychological safety, trustworthiness and transparency, true collaboration, empowerment and equality, choice of interventions, offering people a different choices, and recognising the cultural, historical and gender issues, the cultural competence that's needed. And this applies to schools, it applies to healthcare settings, and what we're going to talk about today, it applies to workplaces as well, actually. How are we creating a trauma-informed environment, and the reflection that we do and the awareness that we have of the impact of trauma on everybody that we engage with. But today we're going to talk about how we use this, how we apply these in peace-building interventions. And ours was for young people, but I think, you know, we need to be thinking about this for our adults as well, for our grown-ups. So we did it with key contacts too, you know. So I'm going to end now. I'm happy to take questions. I see there's questions there. I maybe try and type responses as we go, or I can take questions and talk about them in detail at the end. I hope I've explained that well. It's kind of complicated, but I think it's really important context. So back to David now, and thank you for that. Do we have David? Let me stop sharing here. Hello, yes.
There we go. Thank you, Siobhan. Time for you to catch your breath after that. Thank you so much. That was really insightful. And I think, as I said at the start, with what's happening around the world, I think it brings everything you've talked about into really sharp focus and makes it so relevant. Now, just for those who maybe joined during Siobhan's talk, just a reminder, we're keeping questions until the end. Siobhan mentioned there are already some questions stacking up there in the Q&A. That's at the bottom of your screen. Please keep them coming in and we will get to them. Some may be answered, but through that function, or if we can do it verbally at the end. And just a reminder for new arrivals is also we're recording the event and we will share the slides as well. And I've just, while Siobhan was talking, I just had a quick look at the list of attendees. We have people accessing from the United States of America, France, Germany, Austria, Finland, Spain, and Canada. So particularly warm welcome to all of you. So we're now going to move on, as I said right at the start, to our second speaker, Dr. Colette Ramsey from Ulster University. Colette has a research interest in mental health, suicide prevention and intervention, and resilience and trauma. And she worked as a research associate on the Our Generation project, which Siobhan and I mentioned there, for over 3 years. Over to you, Colette.
Hello, good morning, everybody. I'm just trying to share my slides here. Give me 2 seconds.
We were seeing them there, Colette.
Okay, you're seeing them. I'm not seeing them.
That's you now. No, we have your first slide there. So
it's just I can't see them.
Oh.
Which is very strange. Let's see. Hold on, I've got some weird Zoom message coming up here. Okay. This is tricky. I'm not sure what kind of problem I'm having here, but I can't see. Everybody else seems to be able to see the slides except for me.
Yeah, we've got them here. Would it?
Yeah.
I wonder how we could get around it.
Let me see. I'm in, I've been having technical problems all morning, everybody, and I've almost been in fight or flight myself, trying to sort them out. I wonder what does Chris have my slides. Could you try sharing them?
Do you want to send them to me, Colette, just by email, and I'll share them?
Yeah, let me try.
Yeah.
I'll just have to tell you then when to change slides, but that's okay.
Okay, we can do like the COVID. Well, there's a flashback. Next slide, please. Do you want me to take a question in the meantime? Would that help?
If you want, just send
Yeah,
them.
I'll take the first question there. Should the approach and treatment of mental ill health in Northern Ireland look different because of the trauma context? I think, let me put on my screen again. The treatments are the treatments for the different conditions. So we need to be using the correct treatment. So it's trauma-focused therapy for people with PTSD. And we have the Regional Trauma Network who are delivering those therapies now, and that's really good. But I do think we do need to be, when we're being trauma informed, we need to recognise that people will be coming to mental health services who have trauma triggers that relate to the divisions in our society. And we need to make sure that in mental health services that we think about anything that might reduce the level of psychological safety for those individuals coming to services for that reason, you know. So our health services need to be a really neutral space, and they usually are, but we've got to recognise that certain groups will feel unsafe when they're in mental health services and may need particular types of mental health services to feel safe. You know, young people tell us that they don't particularly like sometimes going to their GPs because it's the family doctor, and they prefer high street cafes, that's a crisis cafes perhaps, that's a safer, psychologically safer environment for them. And we know army veterans often would have mental health services that are delivered in different settings as well. So it's not about the treatment approaches will always be the same, but it's about making sure that people can access treatments and feel safe when they are accessing treatments, recognizing that there's still so much fear in particular groups around who they're speaking to and what they're talking about as well. But the clinicians will tell us that, you know, that it's about the features of the trauma. That's what they're treating. They're not interested in the events that created those traumas necessarily. It's the features of the trauma. But we've got to understand that people will still have a lot of fear. So we need a choice as part of that. We need to avoid triggers, and we need to make sure that people can access mental health services in an environment in which they feel safe, which is usually in their local community, in their local area, which is why the therapy hubs and the mental health strategy for Northern Ireland are such an important thing there. So hopefully that's answered the question. And Colette, maybe you're ready to go. How are we looking?
Yeah, that looks okay. I think it's Chris is sharing the slides. So, okay, so I'm just gonna try to quickly take you through the 10 guidelines that we developed. And as David had said earlier, we had such a process of learning through this project for over 3 years. And Ulster University led the quality assurance and monitoring and evaluation of the project. And we felt at the end of the 3 years that it would be really worthwhile to pull all this learning together, so that it may in some way provide guidelines for other organisations doing similar work. And so hopefully you'll find them useful. They're not exhaustive and by any means. But I'll talk through them now. So the first one, I don't really need to talk through this, as Siobhan has kind of covered both of these already, the 4 hours of trauma-informed practice and the 6 core principles. So the first guideline really is that these should be integrated throughout all organisations, from leadership, policy, training, right down to the frontline staff. So these are really the foundation, you know, on which you would build your trauma-informed approach. So can you go to the next slide, Chris? Okay, so the first one and the 6 principles align quite well with what we have discovered as well. So these are kind of expanding on that. And so the first guideline is really around creating safe and supportive environments. So safe and supportive environments and spaces are necessary for the delivery of programs, and these would include physical, psychological, and virtual environments. And so the physical environment is really just, you know, where you're running the program, the type of seating, the temperatures, the lighting, any food that's available, the washroom facilities. These can seem very basic, but especially when you're working with vulnerable children and young people, you need to be mindful of everything that you're doing when you're running these types of programs. And just as one example, we had a program where at one point, and it was a relaxation exercise with younger children, the lights were dimmed, and for most children this probably would be quite relaxing. However, for one child in the room, became very distressed about the lights being dimmed, and they were afraid that it was going to be dark, and it obviously triggered something for them. So small things like that is just to pay attention to all aspects of the environment. And again, then the project started during the COVID pandemic, which caused huge problems in terms of bringing groups together and actually physically having programs available. So a lot of programs adapted well and moved to online spaces. And then that brought to light, you know, how do you create safe and supportive environments in an online space? Often people were at home, they were on Zoom, they maybe had no other people around them. So it was really giving some thought to where will the person be when this is happening? You know, is it safe for them to be on their own? What sort of information are we asking from them, even if they're registering online? You know, are we asking any very personal questions? And what sort of supports you can offer to people that aren't physically in your presence? So that raised a whole new issue. So again, it's just to, you know, when you're thinking about safe spaces, that an online space is something very different to a physical space. And this is important because safe spaces really allow children and young people and adults, and as Siobhan explained already, these programs, a lot of the programs were available to key contacts like teachers, social workers, youth workers, play workers. But these safe spaces allow children and young people to build their confidence, their knowledge, improve their resilience, and really give them an opportunity to name and understand their emotions, to experience failure in a safe environment without any risk of harm or consequence. If you can move to the next slide, Chris. Okay, so trustworthiness and transparency. Again, trustworthiness and transparency equate to a culture of relational connections. And as Siobhan explained, that's almost the fifth R when you're looking at trauma. So, as establishing strong and trusting relationships that have resilience to move through conflict in a transformative way. So you need to be resilient and have strong relationships in order to build peace, really. Learning is not possible if a person is in a state of dysregulation, as trust and psychological safety are really necessary for people to be able to emotionally regulate. It's important that processes are communicated about across all policies and procedures, so that any potential triggers or challenges that may arise within a programme are identified. And Siobhan spoke a wee bit about trigger warnings and how effective they might be. And we had originally started out using that term for programmes, but moved away from that and tried to look at a sensitivity warning instead. So it softens it a bit and it doesn't immediately trigger people thinking, oh my God, there's going to be triggers in this program because we've said that at the outset. So again, just small changes in language can make a difference. And again, Siobhan touched on this, so it's really important that these peace building programs which bring people together need to undertake a considerable amount of work to develop trust, so more so than other groups where the participants are all from the same background. Because people are coming from diverse background, it does take a lot more work to build trust in those groups. And often these people have maybe a limited history of contact or maybe a history of conflict between the groups, so it's important that that's acknowledged and that the extra work is done to try to build trust there. Again, looking at childhood adversities, children and young people who have experienced childhood adversities, including issues relating to the Troubles, are vulnerable and may have experienced a lack of trust in adults. So it's really important that trust is built with the adults that are facilitating the programme, and also that the programmes promote positive and trusting relationships between the children and young people and these adults, that's critical to the development of their own life skills. So Chris, if you could move on to the next slide. So peer support, so we had quite a few peer support problems and mentoring problems in our generation project, and this enhances connection, trust and healing for children and young people, and again their key contacts. And ultimately, you know, children listen to children and young people listen to young people. So peers are very often in a better place to relate to children and young people than adults or professionals. So it's really important that there's a focus in programs on how can you develop and establish peer support mechanisms for these different age groups. We had looked at peer mentoring and social action projects that implemented a social empathy framework, which really focuses on valuing and empowering the children and young people in their communities or in their schools or wherever the programs are being run. It's important to use a trauma-informed approach when creating these effective and inclusive peer supports. And again, this requires planning and sensitivity, and also a lot of education of the young people that are providing the peer support around a trauma-informed approach. Finally, I suppose peer support discussions and groups need to be facilitated by highly skilled individuals. So they need to have structured boundaries. They need to understand what their role is and what their role isn't. Help them to foster trust and manage any challenging situations that they might encounter while they're providing peer support. Chris, can you move to the next slide? Okay, so collaboration and mutuality, these again are core crucial elements of a trauma-informed approach. And that's really around everybody working together, everybody being treated equally, recognizing that everybody's involved, everybody that's involved is valued and has a role to play in this program. Again, that's important to create supportive environments, and this is for both staff and participants, organisations, stakeholders, a place where young people and marginalised groups can all work together and grow. And sometimes we focus so much on the children and young people that we forget about the staff, how we're supporting the staff and how they feel around collaboration of programmes within organisations. So the programme should embody a collaborative approach that's inclusive with effective leadership, and it's embedded in authentic engagement. So it's not all about just, you know, getting the numbers through. It's about really thinking about the outcomes of programmes. Are these programmes effective? Including all these factors and collaboratively designing or co-designing programmes will ensure that all aspects of the individual's life are acknowledged. Chris, if you can move to number 6, please. Okay, so empowerment, voice and choice. So this is a big guideline. There's a lot of information here, but again, this is important so that all these elements can ensure the effectiveness and the relevance of the programs you deliver. So again, looking at the organisational structures, they should foster empowerment and autonomy for staff again, as well as participants alike, and allow flexibility of the programs that they are delivering. And by that, I mean, you know, just offering flexibility around how young people engage. Obviously, you want the young people, children and young people to engage with as much of the programme as possible. But what we found as part of our quality assurance, we did a stakeholder engagement exercise, and we were quite surprised by some of the young people asking for more flexibility in programmes, particularly young people who were vulnerable or had anxiety, low confidence. We're asking about the potential to have flexibility to opt in and out of certain aspects of programs. So, for example, assuming that all young people want to have fun and have games and fun and icebreakers and all these lovely things that we include in programs to try and make it less formal. Some young people were saying, can we opt out of these? Can we opt out of the icebreakers? Can we opt out of any of the fun exercises? Because they didn't feel comfortable in groups, and they definitely didn't feel comfortable in groups when they were kind of forced to have to speak individually. And so having that flexibility, and always having the flexibility, I suppose, for people to opt out if they feel that the programme isn't working for them. It's important that the programmes empower them to make decisions about their own well-being and managing this, and also to ensure that they have a voice and choice in developing the programme from the beginning, especially when young people have experienced adverse childhood experiences. they can feel that a lack of choice equates to a lack of power. And whenever they feel a lack of power coming into their life again, it can make them very vulnerable and almost re-trigger any trauma that is already there. It's important that they, obviously we take to consent for all children and young people under 16, but it's important that they're really well informed around what the program is about, what are the risks or benefits of engaging in that program, and that the language used to give them this information is very clear and leaves no questions for them around why they would engage with each program. A strength-based approach is really important because this focuses on children's strengths and resilience and supports developing skills, their own skills and talents and positive coping strategies. So all of the things that we looked at as outcomes for the project overall. And in addition to that, I suppose different strategies to develop would be things like self-reflection or group discussion. And these can gather insights and really expand upon what's not working or what is working in the programs and what needs improvement. And this works best when there's almost a continuous feedback loop, which kind of informs the ongoing adaptation of programs to meet any changing needs in communities or schools, etc. So empowering voice and choice should extend to encourage active citizenship for children and young people, and particularly young people. We found that they became, especially through the peer mentoring and other mentoring programs or social action programs, became very active in their local communities, and there was a real community benefit as well as an individual benefit to their attendance at these programs. Chris, can you move on to the next one? Okay, guideline 7, 4 more to go. So this is inclusivity, cultural, historical, and gender issues. And again, the recommendation here is that organisations move past the cultural stereotypes and biases to offer responsive services, whilst also recognising any historical trauma that groups have experienced. And I think services are having to be more responsive than ever on these issues. So they need to be able to acknowledge and respond to cultural, historical, intersectional and gender issues to inform services. And this is an ever-changing landscape in terms of minority groups, in terms of gender issues, and just making sure that services are fully inclusive to all. And an example of this would be, and sometimes it's difficult because we have habits that we have formed over a lifetime, and particularly in schools where you would find teachers saying, you know, just addressing the class as girls or boys or girls and boys. And even just that simple language that's been in existence for, you know, however long, is excluding any young people who feel that they don't identify in a binary way. So again, just important to revisit and be aware of the language that's being used. Identity complexity through diversity and exposure to different social and community groups, and understand the awareness of different perspectives. So a lot of the programs included activities around trying to understand the perspective of others, the concept of integrative complexity thinking, so that 2 perspectives can exist at the same time. And then also to continually assess participation and diversity objectives to ensure involvement of hard to reach and excluded participants. So really having a look at the demographics of who's been coming through the programme on an ongoing basis, and identifying if there are key groups that aren't engaging and maybe for some reason are feeling excluded, so that more proactive outreach can be done to try and get those groups to engage. And finally, staff should receive training on cultural competence, historical context, gender sensitivity. Again, all of these things which are ever changing, but it's really important that staff are kept up to date on all relevant issues. So promoting awareness of others' experience and creating personal connections with diverse cultures can address prejudice through the promotion of empathy. So it's really raising awareness, increasing knowledge of children and young people of others' experiences with a view to increasing levels of empathy. These activities can lead to shifts in social development that promote integration, mutual understanding, and teach young people how to use their own strengths and points of view to contribute to a diverse environment. So really just understanding that we are all different and it's okay for us all to be different. So Chris, can you move to the next slide? Okay, so the promotion and development of social and emotional learning. So Siobhan talked briefly about this as well. So really developing this in children and young people's programs are critical to children's development and effective learning and positive outcomes. And this is like a brief list of some of the things that need to be included in programs to give the children and young people the opportunity to learn about these. So the first and the main one is how to articulate and manage emotions, looking at emotional regulation and emotional recognition. And we found that, especially with the very young children, there was a lot of learning around different emotions and what they look like, getting them to be able to recognize all the different emotions when they arose. And then moving on from that, supporting them with ways of regulating those emotions and being more in control of their emotions. And we did, in the stakeholder exercise, have some parents telling us that their children were teaching them how to regulate their emotions. So that was interesting, but brilliant that the children had learned so much that they were able to take this home and explain it to their families. Again, just strategies to better cope with stress, problem solving, and navigate any challenges that they might face at different stages of their life. Activities to improve social and emotional well-being, so things like mindfulness, relaxation, and then how to deal with conflict and improve conflict resolution skills. And that was really key to the peace building aspect of it, especially when you're bringing groups together from diverse backgrounds. Again, looking at empathy, teaching them to really understand other people's perspectives and feelings and communicate these appropriately, and to build and promote empathy by discussing their feelings and the experience of others and how their own actions can impact others. So it's not just about understanding how others are feeling, it's understanding how you can impact that in both in a negative and positive way. And then finally, just how to access support and provision of care and support when they need it. So we'd suggested that every program has some sort of supports built in that people can either access during the program or that are available to them afterwards. And in some cases that may be just as a key person in the organisation, or it's a helpline or some sort of online support that they can access if they need it during or after the programs. The next slide, Chris. Okay, so this is really the key part of the Ulster University role in the project, was the quality assurance and design and continuous evaluation and improvement of the project. So we would recommend the collaborative development of all programs by professionals and experts, including experts by experience and informed by the academic literature and research evidence. So it's quite a team of people you're looking at to really produce a collaborative piece of work in developing a program. But I suppose encouraging involvement of all these stakeholders, especially experts by experience from the outset, can limit any problems that arise once the program's being rolled out. Again, there should be a coherent theory of change with identifiable outcomes linked to that theory, and Siobhan has talked through the findings that we had. We had key performance indicators that we used for the project, and these were what all the surveys, etc., were measuring as we went through the programme. We looked at, or we would recommend, digital resources. First of all, probably because we started during COVID and it became much easier if partners were able to develop digital resources. It made resources much more accessible to people. And also we found that programs that included workbooks that were maybe part of the program added value and then helped to embed the program content and provide valuable tools for future use. So workbooks that they could use and then take away afterwards and continue to use in the future. And again, as I mentioned before, all programs should include information on supports that can be accessed following participation. Again, looking at workbooks, we also recommend having some sort of facilitator manual, and that's really to ensure consistency of delivery. I mean, this was a huge project. There was over 40,000 participants. I'm not even sure how many facilitators were out there delivering programs across Northern Ireland and the border counties. But just to ensure consistency, that there's some sort of facilitator manual that can be referred to, and that this should also when we look at safety again, include information on facilitator self-care, supervisions and supports that are available to them. And then finally, our key piece of work was having that robust monitoring and evaluation framework in place, and having that established from the outset, and that was done collaboratively with all the partners. So that was a mixture of quantitative and qualitative research, surveys that were complete by participants, and I suppose the real qualitative work started at the very beginning when all resources were reviewed by the university. So we reviewed with the partner to make sure that there was nothing in there that was outside a trauma-informed approach, or there was anything else that could be added to improve a trauma-informed approach. Programs were observed, so the university observed programs in action on the front line as we went through the project. And then finally, the questionnaires were administered to all the participants to really look at those pre and post differences from attending the projects. And that what this allowed as well was that it allowed any issues or barriers or developmental opportunities that arose to be worked on and programs adapted as we went through those 3 years, rather than wait until the very end and then make the changes then. So we have learned a lot over the 3 years. And then slide 10 is really that community resilience needs to be built into programs as well if it is a peace building program. And that really programs should look at this on 3 levels. So you're looking at individual resilience, you're looking at family resilience, and you're looking at community resilience. And these include relationships in families and schools, workplaces, community settings, etc. And these 3 levels are necessary if you're looking at overall peace building. So a lot of what we talked about was focusing on individual resilience. This is really important for an individual to be resilient before they can meet other groups or diverse groups and try to work with them, or the family, or work within their family. I mean, we engaged a lot of parents in parallel programs with children and young people, and really looked at those, the core family beliefs or the behaviors within the family that maybe were coming from transgenerational trauma. And we had some suggestions that work with families should also be expanded to include work with grandparents, because a lot of the times, we're coming out of the troubles now since 1998. Sometimes the key messages around transgenerational trauma were being perpetuated by grandparents or aunts and uncles or whatever, rather than the parents or siblings. So it's important that those 3 levels are considered in all programs if we really are looking at peace building and expanding that out from the individual through the family and out into the community. Can you put up the next slide, Chris? So looking at the community aspect of peace building and resilience is applying that ecological approach. And part of that in programs should really include regular participation in community activities and events and civic engagement. So getting the children and young people out into the community, being active in the community, fundraising, or whatever activities that are really good for the community or contribute to the overall well-being of the community. Again, we talked about the indicators that we used, and it's really important for peace building that at all levels these should include aspects of intergroup contact, so bringing groups together, looking at intergroup trust, and again promoting empathy and perspective taking for individuals so that they can really contribute to those groups. For family resilience and peace building, programs need to include ways of strengthening family relationship, including empowering parents, supportive parenting, and improving communication between parents and children and young people. And so we had some partners providing evidence-based parenting programs that really focused in on the individual, family, and community level, and could look ultimately at preventing the generational transmission of ACEs. Also, it's important to collect information about the community needs on a basis so that ACE-related programs and activities reach the families who would most benefit. So, you know, what is going on in the community? What are the issues in the community relating to things like the cost of living crisis, maybe immigration, anything at all that might be relevant to that community, and adapting programs so that the community, or so that the programs are meeting those community needs. And again, for the individual resilience and peace building, even though some programs focused purely on individual resilience, it's important that the link is drawn between this individual resilience and community resilience and peace building. And finally, as we said before, peer support programs, peer support groups, and mentoring should be developed, friendship networks, and all work towards fostering that really important civic engagement for children and young people, which, to be fair, the young people, particularly those over 11, really involved and became very passionate about any civic engagement aspects of programs. Okay, can you go to the next slide? Chris, so that's the 10 guidelines. So just to summarise, as I've said, these have been developed from the Learning from the OG project, and we would see them as almost a foundation for organisations that are developing programmes to build peace and improve resilience. And as I said at the beginning, it's not exhaustive. The list is by no means exhaustive. And we probably could have came up with another 10 if we had spent more time going back over all the learning that we gained, but we really focused on the 10 most critical or most important guidelines that we could see. A trauma-informed approach necessitates a commitment to deep reflection, strong leadership, and ongoing training. So it's really important that organisations almost do that audit of themselves and look at where they sit in this trauma-informed approach and look at what training can be given to staff to make sure that everybody's on the same page with this. For us, we looked at the ACEs training, ACEs 1 and 2 training, integrative complexity thinking training. So whatever's available, or whatever you can do. And then again, as we mentioned before, anything around cultural specifics or gender specific issues. We see the guidelines as providing a framework and a starting point for organisations as they embark on a journey of change towards trauma-informed approach to peace building and building resilience. And this requires ongoing work to improve knowledge, skills and attitudes among all staff. It requires time, trial and error. We had a lot of trial and error, and a genuine commitment to the goal of recognising the extent of trauma in your area or your community, working to reduce this and avoiding re-traumatisation throughout that, and ultimately promoting healing and growth. So by incorporating these guidelines into programs, we think that organisations can create a comprehensive initiative that will empower participants, build resilience, and promote peace in their lives and in their local communities. And if you're interested in reading the full document on the guidelines, you can find that on our Generation website, and the link is here at the bottom of this screen. So that's it from me and the 10 guidelines, and I hope you find that useful. And we'll go back now to look at some questions that have come through as we've been speaking. I can see there's quite a lot there.
Colette, many thanks. Thanks very much for that. It's really comprehensive. And thank you, by the way, for working through your technical difficulties. And thank you for Chris in the background for doing the slides. But I think anybody who's venturing to sort of work in this area, it's could look pretty daunting about how to approach it. But actually, those guidelines could provide such a really good framework and support. So thank you to you and colleagues and Siobhan for working through all that and presenting it like that. And it's great that it's publicly available as well for everybody. So as you say, there are some questions there. I think there are about a dozen there now. Siobhan very helpfully jumped in and answered one of them already. And I suppose it's probably fair if we work down through them time-wise. We've got a question there at 10:37 with somebody with respect talking about media and trauma. As someone with a family of young children, but who can also work with the children, are there any strategies we can do to protect them as much as possible from the triggers they may see on the media?
Well, I take that one, yeah.
Mm-hmm.
So I have a wee 6-year-old as well, and to be honest, it's got to be age appropriate, and I try and avoid news coverage of the war and conflict in different parts of the world, including Northern Ireland. But I do talk to her about what's happening, about what the flags are about what the marches, anything that we see. I talk to her and try and make it age appropriate. And she's realizing that death is a thing, and this is just really difficult. But I think it is about giving them the news in such a way that they will be able to understand it, and having a good the relational connection is fundamental there, so that they can ask you questions and you can answer that in a way that hopefully is answering their questions honestly without promoting fear or too much fear. But this is it's a tricky one to navigate. But if you maintain a good relationship and you are there a safe space as a parent, that connection is there, they will feel safe with you. Those are the basics of it. Parenting, and I have some great parenting programs where they cover this sort of stuff as well. But I would just switch it off. But it's impossible to avoid, and I don't think it can be avoided or should be avoided either. It's about just making it age appropriate. So
great, thank you, Siobhan. I've got to keep moving along. The next one, how do we at a relational level with our friends and communities create cultures of openness and tackle mental health stigma whilst recognizing that talking about traumatic events can be potentially harmful? Goodness, these are really good questions. Thank you for keeping them coming. Siobhan, do you want to do that one? Hand up there.
Yeah, absolutely. I think it's about talking about feelings. Mm-hmm. Rather than talk about how we feel, connect with people as individuals and ask them how they are and mean that. And that's where we're talking about the feelings and how we are behaving, rather than actually going into what happened to you, what's wrong with you, wasn't that awful that such and such did that to you. Do you know what I mean? And there's a difference there. So you have people who are genuinely concerned about you, and then other people who are there for the gossip and the gore and the detail. So that's what I think is the way to address that. We have to be open about how we feel. When we feel safe, we don't have to do it. There's no requirement to talk about our mental health, especially in social media. When we are not safe, we're actually not safe, so that needs to be understood in those contexts. But we need to have our safe people that we can talk about our feelings and recognize that sometimes it's not helpful to talk about the traumas in that much detail, but to acknowledge what's happened to us and get help if we need it. Colette, you're looking to get in.
No, I was just going to say, we learn from some young people. I mean, often spending time with young people, you can learn a lot from them, and that they often, when they are speaking about something that has happened, they are saying, do you mind if I tell you this? Is it okay for me to tell you this? Or are you okay to hear this? Which I thought was really interesting, because I think for our generation, we tend to just go in and tell it without kind of asking permission, or asking, is it okay for me to tell you this now, or maybe tell you a different time or whatever. So it was almost just testing the water before you start talking about a topic or something that has happened, to make sure that everybody around you is ready to hear it. That makes sense.
Okay, thank you, Colette, and thank you, Siobhan. Moving on to the next one, how do you measure the effectiveness or impact of trauma-informed approaches? Are there specific metrics or indicators that are more valuable? Who'd like to take that one? Sure.
I can start. Colette probably has ideas too. I think you can ask people if they feel safe in an anonymous survey, in a really safe survey. You can actually ask them, and I've seen this done in organizations where they do a survey, they give people the opportunity to talk about what's really going on in a way that's truly safe, and they will tell you, and you'll know then if your trauma-informed approach is landing well, and people will leave your organization as well ultimately if you're doing something that's harmful or triggering for them. So there are no metrics or indicators. It's really about that deep reflection and looking at how, and those connections are so important. If people can connect with you and tell you what's really going on, then you know you've done a good job. And the more of that connection that you get, the better. But it takes courage. And this is the complete opposite of the kind of thing that's happening in our schools, as an example, and in many workplaces too. But good leadership, this is what good leadership is. It's Brené Brown's daring leadership, daring to connect and really care about people and want to understand what it's like for them.
Mm-hmm.
Okay.
We've some indicators. You can look at our indicators for our generation if you want to know about intergroup trust and empathic concern, and we're building on those. We want to develop this further, take those, but it's going to be unique indicators for your organization. There's no recipe book for trauma-informed practice. It's a commitment, it's an attitude, it's deep reflection, as we keep saying. It's that commitment to doing better all the time and to really connecting with the people that we're working with.
Okay, thank you, Siobhan. Another really good question here. I think I know the answer to this one. Should we involve our political parties in being trauma-informed and the responsibilities they have, educating them on how damaging or triggering their behaviours can be?
Yeah, this is the problem. This is the problem. And they're looking for votes from particular communities, and fear is a very, very, very powerful driver. It drives a lot of what we do. The fear response, the negativity bias, all of that stuff is operating in Northern Ireland, and we have divided the system of government. The structure of government is that the parties all have to work together despite being very different and holding opposing views. So the leadership there, where you have a single leader who's dictating everything, and we know we can feel psychologically safe because the leader's got this, that's not there. It's a huge issue, and the more awareness we have of trauma-informed practice and what it looks like, because a lot of our political parties have a great interest in trauma. They're very interested in that as a topic, so let's use that, and we can do better there. And ultimately people get into politics to make the world a better place too, so I don't want to be too negative, but this is a very important point you're making there, Gareth.
Mm-hmm.
Okay, moving on. Interesting one here again. What about the experiences and responsibilities of newcomers in a post-conflict society? So I'm looking at ourselves in Northern Ireland here, somebody coming and settling here, but not from here, hasn't been through the troubles. How can our presence be helpful or harmful? How might we be helped or harmed in places with this kind of history?
Nice. I'll start on that one. I suppose I'm thinking for our project, we were really actively trying to engage people from diverse backgrounds, and a lot of the work was focused on perspective taking and different perspectives, and it would be ideal to have other people with different perspective in those groups, but it might be in how we're trying to engage people that maybe people who have come into our society from somewhere else don't really see these programs as being appropriate for them when they really are. And I think it's important because there is an element of the people who have lived through the Troubles in Northern Ireland, whose parents have lived through the Troubles, have almost normalised that, and often forget how tricky that period was. But if you're coming in from outside and then you're hearing these stories, or listening to people's experiences, as Siobhan said, that can almost be as traumatising if that's something that you're being faced with all the time, but again, not being offered any sort of supports in how you manage that. So what I would say is, if you see programs in the future, hopefully we will have programs running in the future again next year, please come forward and engage with the programs, because I think it is, our society is becoming more and more diverse, and it's not really about just the two-sided argument anymore. There's so many other people coming through from different countries or different cultures, and so when we're exploring diversity in programs, we're really looking at lots of other contexts as well.
Can I come in there as well? This was a really good question. Really got me thinking. I don't think there's responsibilities that newcomers have to sort out our stuff for a start, but diversity is good and positive. However, because of our history, there are a lot of people, individuals and communities where fear is really, really high. There's a fear of the other, of somebody that's different, and especially where you have a scarcity mindset, where there's not enough resources to go round. Whenever you have other groups that are competing for those resources, that activates people, that activates it's a trigger, it's a stress response. It's like people are taking away, you know, and that gives rise to hate crime and racism and all of the stuff that newcomers face. And let's face it, a lot of our newcomers are actually, you know, they've been victims of trauma themselves. They're coming highly traumatized. So I think we need to work to make sure that people recognize that diversity is a positive and good thing. We need to recognize and target hate in a targeted way, and hate crime, and be really clear about that and where that is. And we need to create safe spaces for newcomers so that they can have places where they can meet other people who are like them and have those relational connections. And as I say, you know, we've included newcomers, and they're included in all the peace programs. They must be included, and that's actually part of, if you look at Peace Plus, I'm on the monitoring committee, that's a really important part of Peace Plus. So that program particularly is doing its best, but we just need to get the message out there about how important diversity is, and how important safe spaces are, and about how triggers can manifest in all sorts of different ways for different people who've been hurt, you know, who are here. So it's about getting the message out there and more awareness as well.
Okay, thank you. Moving on, Emily's made a posed a good question here. Clearly, she works in the sector of young people. Her organisation creates safe and social creative space for children and young people. But she says, as Siobhan, as you said, you mentioned over cross-community interventions bring this language of division into the room. So how can we articulate the impact and need for what we do in good relations terms when our work is, you know, really organic and indirect?
And this is a really, really important point. That peace building interventions tend to be designed so that we have this contact theory as the theory of change. And I'm encouraging anybody who's doing peace interventions to think about the theory of change that they're using. Contact theory is, you know, it's not a trauma-informed theory. How do you make that trauma-informed? And young people don't like to use the language of division. I mean, in our generation, Colette will tell you more about this, you know, people really resisted being put into the two boxes that we were trying to put them in. So we need to work at the macro level and make sure that those who are designing peace building interventions and putting out funding programs are aware of this and can think about more creative ways and alternative theories of change. Our theory of change was about emotional resilience. It was about coping skills. It was about integrative complexity thinking. You know, it was about all of those things. And it's not just contact. And here's the other group. Look at how wonderful they are. Because you're getting back to that dairy girls thing where, you know, you can see how when you simply bring two groups together and highlight the differences, you can get the situation that emerges where there's a certain envy of that group better than my group. And we don't want that either. We want people to be proud of who they are. So we've got to do this in a more complex way. And we've got to be sensitive, and we've got to measure the impact of every single thing that we do. So if contact theory is the theory, then let's look at that. And contact theory, remember, it's based on the need for psychological safety as well. So is that psychological safety there as a starting point? And do we have evidence that it is there? So I'm thinking there's just so much of the stuff that's going on, but is it being measured in the right way? And do we know that these are safe spaces? That's a good starting point.
Colette, yeah.
I'm not sure what organisation you're from, Emily, but I'm just thinking of the organisation that we work with, Playboard NI, who ran programs in after schools. So they were outside the school environment, outside the youth club environment, and often with very young children from 4 up to the age of 11. And they took a very gentle approach to this. So rather than really focusing on differences in communities, they just focused on difference. So they did a lot of work on just why people are different, and talked about, you know, where they lived and where they lived looked like. So they would say, for example, you know, we have flags. Well, we have flags as well, but the flags are different colours. Do you know what I mean? But we both have flags, you know. So, and a very gentle approach around maybe taking children out around different areas, letting them take photographs of things that were the same and things that were different. So it wasn't really focusing on that real hard diversity, but just really creating this appreciation for difference and how that was okay. And I thought that was a really kind of gentle way of easing children into this topic.
Can I come back in there? It's like the social identity complexity model that we're trying to develop programs around now. So what we would be doing is reminding young people or getting them to identify unique aspects of themselves, and then showing them how they're parts of different groups. So thinking about all the different groups that they're part of. So I'm a part of a group of people who wear glasses. I'm also the curly haired group of people who are navigating that challenge, you know. So there's, you know, we are part of lots of different groups, and many of us have health conditions and disabilities that make us part of lots of different groups. And then, of course, there's our religious or faith identities. There's our gender. You know, there's so many different groups that we're part of. And if that's your starting point, then you can create a sense of self that's actually much more complex, so that we are not emphasizing the division between the two communities. But this is no substitute. You know, we still need to go back and think about, if it's just numbers from the two communities, we need to be measuring different aspects of diversity whenever we're looking at these programs as well. But the social identity complexity model is a promising model, I think, for this sort of work.
Great, thank you. I hope everyone out there is happy enough. We've got about another 10 questions. As long as Siobhan and Colette can keep on going, we'll keep on going. We're keeping it going and moving because we want to make sure we answer all the questions. The next question is, were there any particular digital tools that worked well on the project on our generation?
Do you want me to take that, Siobhan? What we did with our generation is we actually developed an Our Generation app as well. And that's out there, can be downloaded from the App Store. And what we tried to do with the app is to look at some of the key indicators, like empathy, perspective taking, coping and problem solving, and build a very, very kind of basic games into the app that focused on aspects of those indicators, and then also asked pre and post questions before the users played the games, so we could see if those games made any difference to how what their skill levels were in those areas. And that app was launched just at the start of the summer, so it's very early days for the app, and it is something that we hope we will be able to develop further. As well as that, Action Mental Health developed 2 videos on trauma-informed practice, and I'm not sure, are they available on the website, David, or do you know?
They are going to be, yes. Yeah.
They're going to be. So there's 2 for kind of 2 different age groups around trauma-informed practice, or a trauma-informed approach. So those are really useful to have a look at as well.
In fact, an update on that, they are now available. I knew they were going to be put on. They are literally available. Probably for today, they're now available live. Yeah. If you're happy enough, I'll move on then. And a really good question from Gareth here, relevant to ourselves here in Northern Ireland. The source of trauma control in communities are still very active, i.e. paramilitaries. How can programs be successful? And are these programs applicable in reality if these big barriers still exist?
Okay, I can take that one. I mean, what we're saying here is, if there's a source of trauma, that we can't be trauma informed. And I don't think it's one or the other. I think we always work to highlight what trauma is. That's what trauma informed practice is. It's highlighting what trauma is and what it looks like, and the effects, the devastating effects of this on communities. And we do whatever we can, on the one hand, to reduce any aspects of our society, or to eliminate trauma if we can, to eliminate childhood adversities. All these things are still a really important part of the work that all of us should be doing. But at the same time, you know, we need to run programs. All of these programs do make a difference. You can see, even from our outcome indicators, the change and the young people, and this is, you know, this is powerful change, empathic concern, perspective taking, empathy, helping people regulate their emotions, developing self-awareness. They're all really important things that we should be developing, but it's not one or the other. So I'm saying we still need to tackle the cause of the problems and the cause of trauma and the source of trauma, and all societies, we need to seek to reduce or eliminate war, conflict, adversity where we can. That's our goals as human beings. But we still do these programs because we know that they make a difference, and we need to study what difference they make and any potential for harm as well.
Okay, thank you. A question here on the project: would you have any more information on some of the measures of how effective it was and the impact it had? That's right.
We have, again, on the website, we have an impact report. I think that's on there, is it, David?
Yes.
We have our stakeholder report. So there's lots, and the guidelines document as well is on there. So you should be able to access those through the website.
Okay, thank you. So the information is there. And Caris, a question here: I'm running a creative writing workshop for teenagers in Northern Ireland that focuses on autobiography. What would you recommend that would allow me to empower their voice but not re-traumatize them?
That's an interesting one. Yeah, I mean, the guidelines are hopefully quite helpful there. I would start by co-designing this with a group of young people, the type of young people that you want to engage with, so that you can understand their perspective. And then I think it's creating that safe environment. I would not, for this sort of thing, autobiographies, you know, it's potentially very, very sensitive. So tread carefully. And I don't necessarily think that this is something where you could be bringing two groups of young people together just for this purpose. It's, you know, you need to create the relational connections, the psychological safety, but work through the guidelines and see how you could get on with what we're suggesting. What do you think, Colette? Be anything?
I think my first thought was just around that, you know, spending time, taking it very slowly, spending time building a safe environment, a safe place, building the trust of the group as well, so that they feel that they can, you know, talk through what they want to write about, in a safe way, you know. And I think so, you know, I think the worst thing you could do is probably run straight into starting writing without building that foundation to making sure that everybody feels safe and that they trust each other, and they're all kind of on the same focus of what they're trying to achieve here.
I suppose ultimately, just thinking about this, it does focus on autobiography, but do young people need to disclose? Is there a requirement of disclosure? And even the safety around that. If you're going to read something about a trauma or an ongoing trauma, then, you know, how can you act on that? Particularly young people who are underage. There's a sort of an ethical issue there as well. If you find out about a crime or a harm that has been, and maybe is ongoing, you know, you just have to protect yourself as well. Make sure that you're equipped to manage anything that you learn about through that, and think about how do you do this in a really safe way that doesn't require disclosure or people to talk about their trauma history in a way that's not managed, because you can't then get them the help or the therapy or anything. You know, it's quite risky. But autobiography could just be very factual stuff about things that are innocuous, you know. It's an interesting one, Caris. Tread carefully, build trust. Yeah. Think about how to minimize the risk there of disclosure, of exposure too.
Thank you, Siobhan. And just to make a point that all the information that people are asking questions about, evaluation reports, etc., all that, and the links to all of those will be sent out to all those who register today. So that's links to the best practice guidelines, the impact report, the animation projects, today's webinar, and the links to the Our Generation website. So there'll be a host of information out there, which hopefully will help answer a lot of your questions. If I can move on to the next question: what if someone doesn't want to engage, but their behavior is clearly impacting on their children?
Oh, so this is a parent that doesn't want to engage, but their behavior is impacting on their children. I mean, if this was somebody that I knew, I would be connecting with them and showing that I cared about that person and trying to develop that authentic connection. and just finding out what's going on for them and asking them to talk about their feelings. And then if it's getting to the stage where it's clearly impacting the children in a way that's negative or harmful, then, you know, you need to think about whether there's authorities that you need to contact there as well. You know, if a child's being harmed overtly, that's one thing, and you need to, well, I would feel that I would need to act on that. But everybody's behaviour as a parent impacts on their children, and the best thing you can do to help that parent is to connect with them and be that safe place for them, to help them regulate their own emotions. And if someone doesn't want to engage, that's a trauma response too. And the pathway is through relational connection. If you can have that relationship with that person. And I always think as well, just I think it's good to, if you have something to say to somebody, say it, and say it once, and don't keep going on about it, but do say it. If there's something really important that needs to be said, that you feel that they need to know, that you feel this way about what they're doing, then that, you know, that's important for you to say as well, but in a compassionate way too. So that's my response to that one. But yeah, we can all think of examples there. Yeah.
Okay, thank you. Moving on, I think I know the answer to this one. What do you think needs to change at a systemic or political level for us to become a more trauma-informed society? I think getting change in Northern Ireland, full stop, in any direction, I think I know what the answer to that is, but over to you, Siobhan or Colette.
The answer to Northern Ireland's problems. There we are. 10 to 12 on a Friday. No, well, I think it is about leadership.
Yeah.
It has to be about leadership, and how do we create a safe space? And we are a divided society. We need to recognise that. We need more awareness of what trauma looks like in our society. And we need less fear, more awareness, and we need to pull people and highlight whenever the leadership is failing and creating more fear rather than less fear. And for me, it's about mental, you know, awareness of the effects of trauma. As mental health champion, it's about making sure that people get treatments for their trauma, and that we lobby for services there. But yeah, it's change is slow, but if we could all be compassionate human beings and recognise that we're dealing with other human beings who have histories and have trauma themselves, then that would make a wild difference. And if we could try and connect with each other in a human way, that would help as well. But this is a big question, of course.
Okay, thank you. And moving on, a question from Caroline there about training. Is there one training or multiple training sessions on subcultural competence for staff working with suicide, mental health and trauma?
Want me to take this, Siobhan? I suppose the easy answer is no, there isn't just one training session. It probably would mean multiple training sessions to cover everything that's needed. If you're looking at suicide, mental health, trauma, and then you're looking at cultural competence, like working with minority ethnic groups or gender identity training. What I would suggest, and you know, we struggled with this ourselves in the project because it was quite a big project with quite a lot of staff, and we were looking at what training was needed and trying to roll that out across all the staff as well and make sure that everybody attended that. It's probably to do a training needs analysis with your staff, first of all, to see, you know, what their needs are, and then maybe try to prioritise that, and then look at sourcing training where you can. And you'll find some training, well, quite a lot of training is free of charge that you can access, although some have quite long wait lists as well. But there are some training that you can do that would be at a cost to the organisation. But really, I think you would need to look at the overall needs of the staff, and maybe we created a training plan of all the training that we felt the project staff needed to attend, and then just tried to work through that to ensure they all kind of attended the core training. And the main one, I suppose, for us was the ACEs 1 and 2, which at the time was free. Not sure if that's still free or if it's available, but it's worth researching and having a look at what's out there, Caroline.
Can I speak to that one as well? I think it's important, the training of your staff, but also the group that you're engaging with. So for a group of young people, it's going to be neurodiversity, it's going to be LGBTQ+, it's going to be BAME issues, you know. So think about who are the group, what do they look like, what are the potential areas that you might feel that you don't have enough awareness of. I know for myself as mental health champion, I did a whole thing on neurodiversity recently because I was, you know, I felt didn't have that. So it's about it's about self-awareness. It's about being safe enough to say, I don't know enough about this area, and also reach out to the groups. They're often really, really welcoming of other groups coming to them and saying, can you come and do a talk? Can you tell us a bit more about the people that you represent and and what makes them feel safe? That's the thing. What makes the group of people that you're dealing with feel safe? It's all, we will always get things wrong, use the wrong words, use the wrong phrases, and it's okay just to be aware of that and apologize. But to get those safety cues, I think there's no substitute for going out into the groups themselves. So hopefully that's helpful.
Okay, thank you, Siobhan. There are about 3 more questions left. So from Olga, do people recover from troubles, trauma manifesting in PTSD?
Yeah, absolutely. Yes. Sometimes they recover without any intervention. People have the symptoms, and then over time, the symptoms just go away for various different reasons. Some people, it takes longer than others. Treatment for, and in fact, a lot of the symptoms that I'm talking about are normal responses, and actually intervening too early is disempowering. So we would not, it's only when you've got symptoms for more than a month of PTSD that we would be saying then treatment would be beneficial. So it's often just wait and see. The body has a way of adjusting and adapting, and allowing people to use their own support mechanisms is a really powerful way of building post-traumatic growth. So people do grow from trauma, absolutely. And you don't always need treatment. In fact, coming in at the wrong time, it's, treatment that requires a deep reflection and a person to go through memories and recode memories, that's not always appropriate. And it has to be done at a particular point in that person's life. And I've heard of loads of examples where people go for assessment and actually it's not going to be beneficial for them to have treatment right now. They need to do other stuff first, or, so this is not, this is not a recipe of you have an illness, therefore you require treatment. People recover. Grief is a normal response to a huge loss. So, and complex grief is different, so it's not a simple thing that people will always require treatment, and people recover and they're stronger actually after it as well, because trauma response is adaptive. It's building the body and brain to be able to cope better when things happen in the future. So that's a really good question, and I'm certainly not about pathologizing the trauma response. And trauma-informed practice is about knowing the difference between PTSD and a stress response, or an acute stress response, or a grief response. All of those things are natural responses.
Thanks, Siobhan, and that's hopefully a really positive response back there in terms of that question. Next one is from Shelley. When will the Regional Trauma Network begin to address trauma that is not troubles related? I expect, Siobhan, you're probably the best place to know that.
Yeah, I mean, there's different. I mean, you could ask the Regional Trauma Network. It's the presenting trauma. Trauma is always very complex, and rarely do people come with just one troubles-related trauma. So I know that's the focus, but I think they deal with traumas they already deal with traumas that are not troubles-related, just by virtue of the fact that trauma is a thing that is not. It's very difficult to pinpoint it to one thing, but. The idea of a trauma network or a hierarchy of traumas, that is not trauma informed. That is an antithesis. Your trauma is more important than mine. Yours is more deserving of treatment than mine. So I have to say that in response to this question. But hopefully the work of the Regional Trauma Network will mean that more people who have trauma-related mental health needs get treatment in parts of the mental health service. So always come forward. If you've symptoms of PTSD, come forward, because there are staff that are employed by the network for some part of their work and then not by others in other parts of their job, if you know what I mean. So it should increase the availability of trauma treatments. But look, I recognize that is an issue, but in reality, more people are receiving treatments for trauma-related mental illness because this network is here.
Okay, thank you. And a question from Sue. Sue, I know we've met and you're designing all sorts of digital health interventions with the Department for Health. Are there any resources that we can access to better inform us with respect to being trauma-informed, such as trauma-informed design?
I'm not aware of any. as you can see from our guidelines, being trauma informed is a really complex thing. So translating that into a digital package that could then be a checklist would worry me a bit if that were to happen. So I'm not sure that there are digital resources that can help with that. But Colette maybe has a different type of answer to this question. Yeah.
No, not really. I mean, there isn't any specific resource that I can think of, but in our experience, I suppose, of producing the app, we kind of took a similar approach that we took to reviewing the programs for, a trauma-informed approach. And we initially conducted focus groups with children and young people, the age of the people that would potentially be using the app, to see, what they would like to have in there. And then we looked at the content of the app. This was all new to us as well. So really looked at the content of the app in the way that we looked at the content of the programs, and just try to identify anything that might stand out or might be insensitive or in some way trigger people or feel unsafe. And then we tested it. We tested it with a group of young people in a school in Northern Ireland as well, just to see how they found it and if there was anything we should be concerned about. But as Siobhan said, it depends on the content. Everything's different. It depends on the group that's using it. So there's no checklist. It's just really trying to, arm yourself with as much information as you can, and look at the trauma-informed approach and try to use that as much as you can.
Yeah, and Sue's come back on this one as well, saying it's more about making sure the design of the digital health doesn't trigger trauma. And it's nearly impossible. It's nearly about making sure that there's somebody checking what people are saying to remove content that could be, and triggering is kind of where this bandied about, but any harmful content that's on an app or that people can put in, that there is that sort of cross-checking that, and we're sensitive to inclusivity, even in terms of how people with disabilities access an app, and, how accessible it is generally in the language that's used. I suppose that's it.
I suppose ethically, we removed our app is just a gamified resource, so we removed any ability for people to interact with others or have chats on the app, because as Siobhan says, the commitment to that would almost require maybe one or two full-time people checking the app or the site to make sure that there isn't anything on there. Some social media sites, I know, like the Samaritans, will just put a disclaimer at the top of the site to say this site isn't monitored, or there's nobody available here to monitor it or answer anything that's on here. But you need to be really careful about what potentially could come out of a digital health app or site.
Okay, thank you for those comments. I'm just looking through the last comments. Most of them are just comments now in the Q&A.
Can I just go back? There was one at 10:36 I don't think we answered, which was about how difficult news can be reported in a way that's also safe for people who may find it particularly triggering. It's just because there's a really interesting podcast of All in the Mind that covers this very issue around trigger warnings and exposure to content online. So I would point you to that, and just for a sort of a more deep dive on it. It's the Claudia Hammond podcast with BBC, All in the Mind, where they talk about that. And really, I would come back to say it's very difficult to report things factually in a way that's not triggering. And because of the nature of social media, you can get consumed by it. So what we can do is increase awareness of the importance of protecting yourself and managing your exposure to potentially triggering content even. So that's how I would manage in that. But again, it's not reporting graphic details. I think it's reporting the news in a way that doesn't report graphic details. But if you're trying to get someone to give money to a charity, often it's the graphic details and the personal stories, the moving stuff that gets the action that you want. So you've got to think about the goal directed nature of this and what journalists are trying to achieve whenever they're reporting, and especially the trend towards the clickbaity type stories where they use a story and they know that it will be triggering and they know that it will get clicks, and that is particularly awful. And we see it all the time. There's media news sites that are thriving on that and sell advertising space on the basis of clickbait that's harmful, triggering content for people. So raising awareness of the need for trauma-informed practice generally is, unfortunately, probably as much as we can do there, and highlighting it whenever we see it, you know, and then avoiding it and protecting ourselves.
Thank you to Orla for your safeguarding link there, for training, and also for Sue for a link to the research paper. Oh, fine, and there's another, Debbie just brought in a question there at the bottom. What is the referral pathway to the Regional Trauma Network? Aware that WAVE refers clients, just checking how student wellbeing can access this referral through the GP possibly. So referral pathways to the Regional Trauma Network.
Yeah, it's probably through adult mental health services or GPs, statutory services, certainly. Now, there's some really good student mental health projects in the Belfast Trust area, so that it would be about going through those services. Unfortunately, there's just different pathways and different trusts, but ask for referral through the GP or referral to adult mental health services, who would then do an assessment for the regional trauma network. It's convoluted. The regional mental health service that's in the mental health strategy will hopefully change this when it happens, and it is going to happen. So
Great, thank you for that, Siobhan. And that's brought us to the end of our Q&A. And I'm looking at the time now, and actually we always said we'd keep to 2 hours precisely, and we're 3 minutes over 12, 3 minutes past midday. Sorry, Siobhan or Colette, do you want any concluding remarks or any last points you'd like to make as we draw things to a close?
No, and just welcome anybody's feedback on what we're trying to do here. You know, do you agree with us? Do you disagree? How can we be more trauma informed, and how can we do this in a way that's helpful? Because sometimes it can feel that we're being very critical of a lot of stuff that's happening. But what do we need now in Northern Ireland to bring this forward, to make sure that our organisations are treating people properly, and that we have more awareness of the needs of our population in a society that's so divided like Northern Ireland. And if we can do anything about the politicians and anything there, you know, how we can make our leader or help our leadership to be more trauma informed, again, that would be very, very welcome. So I would just welcome the feedback personally through my office, or even contact me on social media or whatever as well. And thanking you, David, and your organisation for leading our generation, and to Colette and Tara, who wasn't able to be with us today, but they've been doing all the heavy lifting and looking at this stuff on the ground and translating it. So I'm just so grateful for all their work on the project too. So thank you.
Well, if on behalf of everyone who's still here, and everybody who's attended from that early this morning, who's maybe gone by now, on behalf of us all, thank you so much, Siobhan and Colette, for everything you've talked about today. It's been immense, and you haven't stopped talking. You've hardly drawn breath. So thank you so much for all. And your passion really comes through very loud and clear. So thank you so much for that. And thank you to everybody who's been here today listening. As Siobhan has said, please stay in touch. And if you want to, there's all sorts of information on the Action Mental Health website, our generation as well. So some of the queries that people had about where can they get all the information on this. So thanks very much for that. And I should just say, we are planning to have a Transgenerational Trauma Awareness Day on next year, 2024. So maybe next year we'll see the same time, same place. So if you don't mind, it just remains to me to wish you all a very merry and peaceful Christmas. Hopefully see you next year. Thank you.
Bye. Thank you.
Bye.